Top TV, Truth of the People.
Good afternoon, ladies and gentlemen. My name is Nthenya Boke and this is my wellness show. October being a month of breast cancer awareness, we decided to bring an expert to the studio. He's a young doctor and is going to tell us all about breast cancer, the do's and the don'ts. Stay tuned so that we may all get educated.
Top TV, Top TV, is where to be. Hey.
So, doctor, how are you?
Yeah, I'm fine.
Tell us your name.
I'm Dr. Moses Rauto. Yeah.
So, to the first question, what is breast cancer in general?
So basically, breast cancer is cancer of the breast. As you all know, a cancer is uncontrolled growth or multiplication or just replication of cells in the body. So when this multiplication happens in the body, there will be formation of a solid tissue. That tissue, we will call it a tumor. So when that tumor occurs in the breast, we call it a breast cancer. Although it can move to other places in the body like the lungs, liver, and that we say that the cancer has metastasized, and that will be grade 4 cancer. So
by having breast cancer, if you don't treat it earlier, it will move to other parts of the body.
Yeah, as we usually say, the earlier the screening and diagnosis, the better the treatment and the outcome.
All right. And who can get breast cancer? Does it mean that it's only ladies or even men can get the cancer?
Anyone with a breast can get breast cancer, but mostly it affects women than men. So 1 out of 8 in 8 women can get breast cancer, but for men, only 1 in 1,000. But for those men who can get breast cancer, it only applies to those who maybe have been exposed to radiation around the chest or have gene mutation in life.
How will I know I have breast cancer? In short, tell me the symptoms of breast cancer.
Most of the signs and symptoms of breast cancer will be just around the breast. So most of them you can identify by just inspection. So you can identify a lump around the breast or around the axilla. Axilla is the area around the armpit. So mostly it's a painless lump, but you should know not all lumps are cancerous. There might be benign cancer caused by other benign breast condition like the adenocarcinoma, which is not cancerous. So majority of the lumps are not cancerous. So you must liaise with your doctor for confirmation. Apart from lumps, there are many things around the nipple. So the nipple might be inverted inside, or the nipple might produce some fluid. Normally the breast should produce milk, right?
Yeah.
But when it produces things like blood or just even a clear fluid, that's a red flag. So also you can consider inspecting the area around the breast, especially the skin changes around the breast. Most of the breast cancer patients presents with a reddish or just orange color. It looks like orange peel appearance. So area around the breast, you can also look for other things like, let's just cover that.
And do we have hospitals in Kenya which offer screening, the breast cancer screening?
Breast cancer screening, I think most of the public hospitals do offer breast cancer screening, and most of them are free. Yeah, there always comes for breast cancer screening like thrice a year.
Yeah. And how can I lower my chances of getting breast cancer?
First, you need to identify the risk factors for one to get breast cancer. Then you can avoid those risk factors. Yeah, so for risk factors, first, being a female is the greatest risk factor for getting breast cancer. Because we all know the female have those hormones, which we all learned in biology, estrogen and progesterone. So this hormone, the increased chances for breast cancer. So being a female is the greatest risk factor. Then another thing is age. With age, it comes with the chances of getting breast cancer, it increases with age. So for mostly it happened with the postmenopausal women. These are the women who are in age bracket of 50 and above. Yeah. So also those women in childbearing age, they can also get breast cancer, but mostly those one, they must be a first degree relative who has a breast cancer or who had a breast cancer. First degree relatives, hao ni watu kama tuseme either your mom, your sister or your daughter had a breast cancer at an early age. That doubles the risk of getting breast cancer. Or there's this gene called BRCA1 and BRCA2. This increases the chances of a woman at childbearing age to get cancer, because it increases the chances of getting either breast cancer or just other cancers like ovarian cancer. So when the test is done and one has been identified with the BRCA genes mutation, yeah, that's a really bad thing.
And how can people spread awareness of breast cancer?
You can spread awareness about breast cancer by just telling other people where you have had any information about breast cancer, whether it is on internet or just those many camps which are held about breast cancers around different places in Kenya.
And can you tell us the do's and the don'ts? When you have cancer, what you should do and what you shouldn't, and even if you don't have, the things you should do to avoid having breast cancer?
So for don't, as you all know, alcohol intake, this cigarette intake, anything that has nicotine increases the chances of one getting breast cancer. So if you can't avoid drinking alcohol, you can at least limit your intake to a bottle in 3 days, and you should totally avoid cigarette. Also, you should try living a healthy lifestyle, like doing exercise a minimum of 30 minutes a day for thrice a week. Yeah, just living a healthy lifestyle, that will be helpful. And for girls, you should at least try getting your children as early below 30 years, because we have identified that breastfeeding and getting child early is a good thing.
And talking about living a healthy life, do we have a specific food, meal or fruit that we should take?
Most of the Mediterranean foods are good for our health. So we should just avoid these like butter, cheese, because butter and cheese, they have estrogen in them, so they will increase chances of one getting breast cancer. So we should focus on these Mediterranean foods. Like we should opt for like things like olive oil and avoid things like red meat. Yeah.
How can, let's say someone maybe wants to know more about breast cancer, where can she or he get more information?
Yeah, information about breast cancers are vast. You can most of the doctors know information about breast cancers. Also, the internet has vast information about breast cancer. I'm sure even your fellow colleagues know most of information about breast cancer, about the self-examination, the mammography thing, the screening things. Yeah.
Talking about mammography, is it the best choice to take during the treatment?
Mammography is a tricky one, so it has age cutoffs. So majority of those with breast cancer below the age of 30 is a tricky one, because below the age of 30, let's just say between age bracket of 30 and 40, the breast is of high density. So mammography is just an imaging, it's an X-ray imaging with low radiation. So it will not depict any mass or tumor in a high density breast. So for that, most of the cases of breast cancer will be unnoticed, and someone might even be on stage 4, and that will be a late diagnosis. So someone has to do other tests like ultrasound, especially for those with high breast density.
Does breastfeeding has a benefit?
Yeah, it has a lot of benefits. It reduces the chances of getting breast cancer. Not just even breastfeeding, even getting children early enough is a good thing. Also, I forgot to tell you that, you know, when someone experiences her period early in life is a danger sign, and also when menopause comes very late in life is a very bad sign.
So having a child earlier is a bad sign. At the same time, having a child late.
Having a child earlier is a good sign, and having many children is a protective or is a good sign.
All right. Talking about the cancer in general, at what age or at what stage does the hair fall off, or is it the treatment?
Cancer does not cause hair to fall off. It's just the side effects of the chemotherapy. So for cancer patients, because there are different modalities of treatment for cancer patients, basing on multidisciplinary approach with different oncologists, doctors, nurses in play. So for cancer, it all depends with the type of cancer, the cause of cancer, either it is caused by estrogen receptor, progesterone receptor, or just HER2/neu. So there are like 5 different ways of treating cancer. It can be either surgery. I know most of us know about the surgery. So for surgery, there are 2 ways we can do it. Either the lumpectomy, is just you remove a portion of lump on the breast area, and there is mastectomy. So for mastectomy, you remove the entire breast. But nowadays there can be a reconstruction surgery, so it's not a bad thing. For mastectomy, there can be a prophylactic mastectomy. You see, especially for those young girls who are at risk of getting breast cancer, those one I told you about, the first degree relatives, or those one who have the genetic mutation, or those of BRCA1 and BRCA2, they have to do the prophylactic mastectomy just to prevent removal of, to prevent spread of cancer. Yeah.
Earlier you talked about breast cancer grading. What is it?
So grading of breast cancer, it just helps us to know the stage in which one is. So we have like 4 grades. Those are the simple ones. So for grade 1, it just means there are some abnormal cell. For grade 2, it means there's formation of a tumor, but it is less than 2 centimeters. For grade 3, there's formation of a tumor which is more than 2 centimeters, and maybe it has reached the area around the lymph nodes in the axilla. But for grade 4, that one is a tricky one because it has already spread to the other parts of the body, like I said earlier, maybe the lungs, the brain, the liver, and it's a tricky one to deal with. For grade 4 cancer, there's no treatment for that. We just try to manage the condition because the cancer has already spread to the other part of the body, so dealing with it will be quite different.
Putting the breast cancer aside, how did you feel about winning the Badminton Player of the Year, and how do you cope with it? Like, how do you manage being a doctor and being a badminton player?
Most people think that doctors don't have that time, extra time to do their other things. But when you learn to manage your time well, you can always have that extra time to do other things. Winning a badminton tournament, that meant a lot to me because at least I know I'm better at other things other than just books.
All right.
So my advice for you guys is you just need to familiarize yourself with your breast. You can do just the self-examination for your breast so that you can detect the early tumor or early mass as early as possible. This can be done for childbearing age 10 to 5 days after your cycle, and for postmenopausal woman it can be done anytime. And always remember, being diagnosed with breast cancer at an early age does not mean it's the end of you, because there are many survivors out there, and with the facilities we have, with the medication and all this awareness, everything will be fine.
Thank you so much. That was Dr. Rauto, and he told us everything about breast cancer into details. I hope it was informative enough. Until next time, ciao.